I was going to jump in, right?
Explain. So I got this one. So you click on this to move slides. Microphone and camera are looking at you anyway, so everything's set up. Don't worry about anything else. And Howard will introduce you. Thank you, Howard.
So I was given like this long CV to introduce you, and I just shot it.
Good job. Good job.
I also a wonderful scholar. He actually, here's a good quiz question. So he got his PhD from the University of Otago in New Zealand, one of the best academic institutions in the world. I bet you hadn't heard of it. But here's the quiz question. Who else on our faculty graduated from the University of Otago? Miles over. There's some great public health leaders who came out of Otago, and of course, Wael Al-Delaimy. Anyway, after he did his PhD there, he came to Harvard, and that's where I got to know Wael. He was a postdoc and research associate there for 4 years. He was with Walt Willett's group in nutrition. I was over at Scott Weiss and Frank Spicer's group in environmental epidemiology. I used to go to their seminars sometimes, and they're all discussing nutritional epidemiology, but what was really interesting is what they brought in for lunch. I could see they were all like, hey, rabbit food. It was like celery, carrots, and stuff. And I was bringing a ham sandwich. They were looking at mine. I wish I had yours. That's what I thought. But anyway, great work there. Got recruited to WHO to work for HIART in nutrition and cancer as part of his experience there, and then got recruited out here. And now he's this wonderful professor and leader at the new public health school at the University of California, San Diego, doing all sorts of stuff in environmental health and nutrition and climate. And it's such a pleasure to have you here, Wael.
Thanks, Howard. Thank you.
And I'm happy to start at target back.
I'm apologizing for the LA traffic and my other commitments that I had to go to. So how many of you are tobacco folks? Only one? You're environmental as well.
I do tobacco.
Okay, because I'm going to skip through some of the tobacco slides. What I wanted to show here is how they are similar and different in a way, the climate, public health approach, and the tobacco approach. So, this is the model that everybody knows. These are the three main physical activities: cigarette smoking and diet are the lifestyle factors that are impacting health. This is the model that we kind of live in more, and tobacco is one of the major ones there. But going through some of the social norm, I wanted to show this spittoon. Anybody has heard the spittoon? So can you believe it? This is the this is in a court in Chicago. People would spit their chewing. That was the social norm. It kind of, it's not considered gross. It was acceptable, but social norm changed. And that's really a key in tobacco control. So, tobacco was very popular after World War I, and the tobacco industry found this. They did mass production and became a standard for people of all classes. It was very classy to do that. And it was also the healthy thing to do. So a nurse and a doctor not saying do not smoke. It's actually saying like this cover is going to remove the moisture. Don't remove the moisture proof wrapping from your package of Camel after you use it. The humidifier pack protect against the germs. So this is kind of where we were. Even in the 70s, this is a radical idea that non-smokers should not have to breathe second-hand smoke. As a result, the tobacco industry always ahead of everyone else. In 1978, they said the second-hand smoke approach is the most dangerous development to the viability of tobacco industry that yet occurred. Look at how smart they are. They're always ahead. They were true. So now, this is California. from our previous California tobacco survey, and I put the BRFSS because we stopped, the funding stopped for the CTS. But going down the right direction, this is the story of the tobacco use, going up and going down. And in California, of course, we had the most successful program, the leader in the world, really, using these four components to prevent and delay onset of smoking and promote successful quitting, but also reduce exposure to secondhand smoke. That is the key there. And as a result, we had the smoking ban in work. Look at immediately jumped. The reporting, this is from, again, the surveys, jumped immediately to saturation and stayed like that in terms of smoking ban in the workplace. That social norm translated into the home. And so we can see here for everyone, the smoking bans began to increase, even among smokers. Who could believe almost 60% of smokers would not allow smoking in their home? That is how the progress happened over time. And then we had asked questions, and you can see here, like, these are smokers, almost 90 say not to smoke inside cars when children are in them. We gave it to the policymakers, they made it policy. It's illegal since then to smoke when you have a child in the car. So the progress was so progressive and very convincing. We found also that it's not just the smoking ban, the notion of a smoking ban actually helps people quit. In this paper, we asked about actual perceived smoking bans predict quitting behavior, and we found that it would lead to significantly higher quitting and smoking less when those with reported total home bans compared to no bans, as well as perceived or partial complete city bans. So we asked, does your city have a smoking ban? Even if there wasn't, if they had that, they were more likely to quit. So this quote I like from the cigarette century is that it's ironic that the impact of smoking on non-smokers rather than on smokers is what finally transformed the regulation and cultural perception of the cigarette. This really rings true to many. But industry is not going to sit around. So they came through the back door with the harm reduction. This actually is a picture of the report in 2004 that of a conference that I attended, the seduction of harm reduction. I like it, love it. That was when the snus was there. It was become a very big deal, like snus, snus is a pouch of tobacco, you put it in your mouth, and they say this is going to help people quit. It was the, and it didn't, and it died out. And then came the e-cigarettes. So the e-cigarettes basically were trying more or less to undermine these concepts in the California tobacco program, prevent individuals from initiating and then start smoking on their own and delay onset of smoking cessation. So all of these were undermined by e-cigarettes because as you know that cigarettes or e-cigarettes are now more popular and have been more popular among the teens compared to the, so this is the e-cigarette and these are the cigarettes. So you can see it's not cool anymore to smoke cigarettes. From Adam, from your team, this really important paper, I believe it was in JAMA, showed that actually those who use e-cigarettes predict more longer term smoking in all of these categories. All of them were significant. Guess what? The vapors on the vaping advocates were very vocal, more than the industry. They said, well, those youth were going to smoke cigarettes anyway, as they share the personalities of risk takers, which was really unacceptable because they are incriminating those youth that they're bad. They're going to, that's the argument of people, including those who are in the public health profession, unfortunately. So Adam and his team came up with a very nice paper to try and rebut that. Basically showed that whether they're non-users or e-cigarette users, their personality traits were very similar, except for anhedonia and negative urgency, to try and counter that. We published one of the first papers, probably the first cohort, that looked at cigarette use in relation to quitting behavior. And we found that compared with smokers who never used e-cigarettes, smokers who ever used were significantly less likely to decrease cigarette smoking and significantly less likely to quit for 30 days or more. I was attacked on the day it was published from all the bloggers, including some of the folks who are pro-vaping from our own profession. And it was just kind of, now it's proven more and more with larger studies like the PATH study that this is actually true. So, and then the e-cigarettes industry gained ally in regulation fight. So it's kind of the story of tobacco repeated again. And, provision favored by industry was introduced by Rep. Tom Cole, Republican Oklahoma, and Sanford Bishop, Democrats. So that's kind of one of the few times that Democrats and Republicans could agree on something. And then this is from San Diego, e-cigarettes restriction to be eased under bill by San Diego's vaping congressman. So it's kind of the story repeating itself with, and then this big force. I can't tell you, I follow them, how vocal, powerful, and aggressive those people who are the vapors, unbelievable. I go to county halls, they're all there with their power and so on. So switching a little bit more into the ethnic disparity on tobacco use, this is a recent publication from UCSD folks, and showing the kind of smoking, and it's all decreasing in non-Hispanic white, African American, and then Native Americans are up there. But you can see the wide confidence intervals because the data is very scarce, and yet it's still showing overall much higher disparity. So not just that, Native women smoke 32% compared to the white 17%, and pregnant women 26% compared to only 14%. So there's still a big problem in Native Americans. Why? Well, tobacco companies use these strategies in the name of sovereignty and targeted these tribes with exemption. And these include price reduction coupons, giveaways, gaming, and so on. And those also built allies with tribal leaders. The same old game of the tobacco industry. We are leading a project, a very unique project nationally, to evaluate what if the state gave the tribes the tobacco control money, would it work? Because they never tried this. They're sovereign nations, and they don't want to. And so we are tasked evaluating 13 tribes all over the state, and 5 American Indian serving community organizations. So the little dots are the tribes that are served by these communities, and the big, these are the actual tribes. And so we are now in year 3, basically to building capacity and skills evaluation, whether this is going to help them mobilizing and engaging the community and improving implementation for tobacco control campaigns. We're learning a lot. We have a great team, including several Native Americans. So moving now, this is the model of the future. Soil, air pollution, temperature, water quality is going to override tobacco and diet and physical activity gradually. So the transition is already happening. And guess what? The US is also the star of this. So this is the fossil fuel consumption in 1965. And, well, the United Kingdom, interestingly, China was all down here. Now, 2020, still the US is the highest, but look at where China is going, and it's going up. But basically, the fossil fuel is the kind of like the tobacco use figures we saw. And if anyone doesn't know what the climate change is, they've been living on a different planet, but I'm just going to say this anyway, the greenhouse gas emission and the greenhouse effect and the ozone help the UV, the sun rays to enter and becomes a blanket and leading to all of the consequences. This is how the, I'm afraid to push the wrong button. It works. So this is, look how the annual mean temperature has been going up, right? And as a result, there will be a lot of flooding. 130 coastal cities with 1 million or more will be affected by flooding. And these are the dots here. You can see there's more in Southeast Asia that's going to be really, but Florida is also a very big candidate for that. And we know the drought, of course, all over. But just some interesting information, maybe some of you did not know. 1965, US President Science Advisory Committee asked the director of SIO, Roger Rebel, SIO is at UCSD, to summarize the CO2 impact on global warming. With the help of Keeling, which is a very famous Keeling curve, he predicted that in the year 2000, there will be 25% more CO2 in the atmosphere, leading to marked climate change. This is Lyndon Johnson. This generation has altered the composition of the atmosphere on a global scale. A steady increase in carbon dioxide from burning of fossil fuels. 1965, right? So the question, where were we? Sleeping on the wheel? Physically, some people actually do this. I learned truck drivers get the sleep like that. So we were sleeping on the wheel where others were fully awake. How many of you have read this book, Merchants of Doubt? Yeah, so you probably know the story, but there were four characters: Frederick Seitz, Singer, Robert Jastrow, and William Nuremberg. And so they formed this George C. Marshall Institute. They were all very established scientists, you know, rocket scientists, NASA, head of the National Academy of Sciences. It's really top tier. And this guy went to the tobacco industry and said, you know, let's deal with this issue of tobacco control, and got 45 million to generate evidence to defend tobacco and fight science with science, create doubt. Interestingly, later on, he got money from the fossil fuel industry to do the same. So the same people switched gear when tobacco was no more profitable. This is the other guy, Nuremberg. He was the SIO director at UCSD. It was actually there before UCSD, but now it's part of it. From 1965 to 1986. So more than 21 years, this guy was leading this premier institution on oceanography and climate change. And he wrote Global Warming, What Does the Science Tell Us? Basically against anything that science knew from that time till now. And he actually attended the World Petroleum Congress and attacked the IPCC. That is in 1992. To my surprise, I was browsing and saw this on our SIO website. 22 Nuremberg Prize for Science in the Public Interest. How odd is that? Okay. So these are kind of the facts, and plus there were the climate deniers in addition to those who were Senate members, like this guy, James Inhofe. He received over 2 million from the fossil fuel industry. And his staffer said, well, if my boss can do it, I can do it. So he got funding from Exxon and Chevron. This guy has an institute called the Energy and Environmental Legal Institute, very flashy names, but they all go for the same. And the Murray Energy Corp, largest coal company. And then those people, the Koch brothers, $80 billion, okay, worth of fossil fuel related. They started a campaign in 1991. They had a conference against climate change and global warming. This is how early those people have been working. Plus, we still have Fox News denial of 86% of their news on climate. There's also another challenge with climate than that tobacco doesn't have, which is the political affiliation, which Al Gore unfortunately helped without knowing, because he was really a scientist. He worked with Rebel and started the inconvenient truth and was an activist, but then that kind of made, oh, it's the Democrats. And, you know, you hear this, it's a ploy to take control of government and so on, take away your car, your hamburger and whatever. So all of these things make it really challenging, much more than the tobacco in a way. What are the ethical aspects? Well, first of all, that this is a upstream ethical predictor of plundering of resources, consumerism, overconsumption, self-centered and community centered. That you know, it's all about me. I don't care about anybody else. I'll use my resources. I have the money to buy this and that. I don't care. That is the ethical problem we have. The deniers, and then the problem of long-term and gradual impact, like these conditions that don't appear immediately, not like an infectious disease, not like a pandemic. So there are also methodological challenge because it's not an exposure, it's not a single source like smoking or diet. Its impact takes decades, and then too slow or too sudden to document. New methodological approaches are therefore needed. The other thing is that the large scale health outcome data is not accessible. That's always a problem with climate-related data. We need collaboration between countries. For many years, I've tried in the Middle East. Everybody's saying, no, my data, I don't want to give it. I don't want to give it. Well, what are you doing with it? No, I don't want to give it. So that's the problem we have, that countries don't share, and we need that sharing. And vulnerable population are always the people who are going to be impacted the most. And these vulnerable people are even in San Diego. So this map shows the climate equity index. You know, we have places like La Jolla with very high access. These are indexes based on access to food, walkways, safety, resilience, and in all of these aspects. And then we have one of the worst areas in Southeast San Diego, this dark blue. This is actually called designated, one of 22 designated neighborhoods all over the nation that are federally recognized as poor and impoverished and needs support, special support. So they are the same group that are also not climate resilient. We did this study some years ago and looked at disparity in heat waves in San Diego and focused on air conditioning ownership with other factors. And we saw that very logical, you know, the more income, the more likely you have AC air conditioning. And if you own a house, then you have it. The Latino didn't have data on the other small groups. The Latino had much less AC than whites. And then we saw the hospitalization. We have, you know, this is lower AC saturation compared to high AC saturation. And this is average daily hospitalization. You can see a huge difference with the different temperature. With increasing temperature, there's increase in hospitalization. And clearly, those who have the high AC saturation, they are not as well impacted. So what are the potential interventions? Behavior change, that's really important, like it is in tobacco, regarding culture, food, wasting, better governance and political stability, especially in low-income and middle countries, and also the healthcare system that is behind in all of this. But also the golden rule, which is do to others what you like others to do to you. The self-centered concept does not work if we want to address climate change. Advocacy and activism, this is from our book. And basically, Maybach, in his chapter said, health professionals are the most trusted members of every society worldwide. They speak with not just scientific, but also ethical and moral authority. So we need also policy briefs to policymakers, organizing activities, outreach, and task force and professional organizations. So I was called by the American Psychological Association, has 120,000 members. I think it's one of the largest, to form a task force. I am representing health, and there are others, you know, I mean, public health, others on psychology, And they gave us a year to come up with recommendations, and they are now acting on it. I wish all professional organizations would do the same, but kudos for them for doing that. So when we have less climate resilience, less adaptation, it leads to injustice, which is another area that I'm really passionate about. We have to stop injustice. And this came in light with the tragic death of George Floyd, which was caught on camera and united people around the world about injustice against people who are minorities. These are the same people who are breathing the polluted air, suffer the heat waves, and will lose income and health as a result of climate change. So it brings me to my book, which I was privileged to work with the very well distinguished climate scientist from Anatan, and Marcelo Sanchez Sorando, who is the chancellor of the Pontifical Academy of Science. So we put this together, bringing, this is at the Vatican, so I'm here, and the people here are Nobel laureates, and it's very interesting. This is Governor Brown. He was invited to give a speech there, and we came up around 50 or 60 focused on health, on what are the solutions. So the book has been very popular, almost more than now 400,000 downloads from Springer Nature, compared to what I was told by the company that their average book download is 26,000. And it has 33 chapters covered by every aspect you could think: psychology, politicians, biology, economy, faith. Everybody had a say, had a chapter and had a say. But the focus is human health. That's the lynch that's gonna hopefully bring everybody to the table. I want to end with the Middle East, which is, as I said in my book, in the chapter number 10, that it's going to be the epicenter. It is already the epicenter of climate change impact. And for several reasons. First, based on the Max Planck Institute, this will become area so hot that the habitability will become compromised. People cannot be outside for several months during the year. This is how bad it is going to be. These are temperatures in Fahrenheit, and this is becoming longer and normal temperatures throughout the summer. And so by 2100, 80% of summer months are projected to be hotter than 5 standard deviation above the average. This is from the MIT folks, Palin Al-Tahar, and they showed images. This is the historical mapping, heat mapping of, this is the Gulf region, this is Iraq, Saudi Arabia, and all of these areas. And you can see the prediction with the 4.5 Celsius increase, and then the extreme one is 8.5. So it's 60 above Celsius for many months. So it's really gonna be a major problem, but it's gonna affect the most for sick, old, and poor. They are going to be impacted the most, and will lead to instability, refugee crisis. The other problem in the region is the water. So you can see the dark orange. This is the most least freshwater availability. Guess what? It's the same region. This is going to be leading to food insecurity, already leading to migration, famine, and political instability. Yemen is now an example. It's already a failed state. It is, according to the World Bank, the first country to run out of water within a very short period. They live, 70% live in rural areas. There is less dependence on rainfall, severe poverty, ongoing conflict, and about 50% of the population do not have access to clean water. And guess what? The mortality, under 5 mortality is 55, compared to Saudi Arabia 7, compared to Oman is 11. So very devastating situation there, and it is just the beginning. The refugee crisis, we know this picture, and this is, guess what? Everybody is going through the Middle East or from the Middle East, going through the migration, many for economic and climate related factors. and most of them are young people. So I wrote this in the local newspaper saying refugees from the Middle East and other areas will have no choice but to move in masses to other lands by any means. Many will end up in transitional countries, Europe, and eventually North America, because a lot of people say, I could care less. No, you should care, because they will come home to you. The other problem is the dust storms in the Middle East. Like you see, this is the hub of the dust storm origin, places of origin, and it's again in the same region. This is from the National Geospatial Program. Long droughts, low social moisture, more arid conditions, and Iraq, my native country, has been hit a lot. So 122 dust storms were recorded in 2010, but it's going to be multiplied many, many times. This is how it looks. If you haven't been there, like it comes, you can't see, and everything turns orange, and the dust settled on everywhere. Just this year, I was told it was crazy. People were just crazy. Like every week for several months, they were having these dust storms. So I want to end up with the hub on climate change in Middle East and North Africa. We just got funded from NIH. And this is the launch. We just did it in September, this summer. These are the trainees and the faculty from 3 countries, as well as from the US. We have 45 faculty mentors, and we're really excited about it. Just kind of going on the aim. So those who are not familiar with the GeoHub, it's 2 components. I know you guys had it here and still have some component in it. I recall I saw it was USC, and then I went to the meeting. I saw it became Columbia, so it kind of moved a little bit to the west, to the east. So the aim for the science part is to investigate human health impacts of climate change, of water scarcity and heat waves among vulnerable groups in north of Jordan, mostly agricultural workers, and study the impact of air pollution in respiratory, cardiovascular, and skin allergic diseases in Beirut and Lebanon among vulnerable groups. And then in Morocco, we're going to characterize desert dust pollution and the weather pattern leading to pollution through large-scale atmospheric patterns and climate indices. And the 4 is to use the models for quantifying health and economic impacts in relation to nitrate and water and all of these aims. These are the kind of, in a nutshell. And then the training, of course, develop capacity, mentor researchers, support the development of environmental health practices and programs, and increase awareness of public health. These are the people. So myself and Faiz, who is a civil engineer in Jordan, we are the co-PIs. And this is Mariam from Lebanon. She's an epidemiologist. Kenza from Morocco. She's an atmospheric scientist. And from Harvard, Mark Weiskopf, and from Berkeley, Justin Remes. And so you can see here, it's very multidisciplinary. So we have epidemiologists like myself, Harvey, and Jose. We have an atmospheric scientist, Marty, who has written the book Atmospheric Rivers. He's the guru of atmospheric rivers. He is a person who predicts these and has helped California preserve water because of that. We have Borsika, who is a dissemination implementation scientist. And we have 2 economists, as well as data scientists and modelers. So, and at the end, humans and their health are the ultimate beneficiaries of the protection. And there are similarities to tobacco control approach and interdisciplinary science that we will need to move forward. And the Anthropocene and climate change is an existential threat, so we need to do something about it. I'm sorry that I went too fast, but I wanted to touch on everything. So thanks for your patience, and let's open for any discussion and questions.
Dominica will tell us if there's any online. Well, go ahead. I had a few, but let others chime in. Thanks so much.
So thank you so much for this really great talk. You know, one thing that we've been thinking about here that's not maybe as directly climate related necessarily is like environmental chemicals because of byproducts from fossil fuel industries and, you know, those contaminating scarce water resources. So I was wondering, you know, from your perspective, if you have reflections on like how to fit that into this, you know, broader vision and scientific scope that you've been thinking about, and like, you know, how you see sort of that as a critical piece to
In terms of
understand.
chemical contaminants, for example. Yeah, absolutely. I actually had slides, but I wanted to cut it down because,
Yeah.
clearly. So I'll give you an example. I was part of the super fund, the UCSD super fund, which is looking at contamination from Tijuana, crossing across the border into from Mexico into San Diego. The water flows north, interestingly, because there are hilly areas. So the water flows from Mexico across the border into the estuary, the Tijuana estuary, which is in San Diego, and into the beach. And so we went and investigated what's going on in these areas in Tijuana. We found there was so many of these canyons or hills and very deep canyons that are all living illegal settlements. And they're also the dump sites. For what? The dump sites for the Micheladoros, which are the big companies, you know, Philips, Microsoft, you name them. They have these factories and manufacturing, and they dump things in illegally. They pay somebody and they dump it there, and people are living around it. And guess what? When there is, you know, severe rain, flooding, these become raging rivers, and all of the chemicals and the contaminants are taken out to the sea. And we have measured that. We have measured it actually at several places from Tijuana across to San Diego. And we found that the transportation of all of these chemicals from the industry and everything else going where? Into the estuary and then into the ocean. One of our colleagues at SIO did a very fun, I think fun. He got funding from the Science Foundation to have a ship go all over the world, catch tuna, and collect from its samples to see persistent organic pollutants in it. Guess what? All of them had very high levels. And it varied about the type of contaminant based on different areas in Asia and Pacific and Atlantic and so on. So where did these come from? It's from this. Guess what? When we have flooding from these kind of extreme weather events, this is going to be worse. And the more there is drought, the more these contaminants are going to be accumulating. And so they get, you know, washed away. Then the other aspect is the flooding. Coastal areas, when they flood, they are going to, you know, basically spread this contamination among the flooded areas. So it is a cycle that is related. And it is, you know, a lot of the people at the Scripps Institute, you know, oceanography are looking at the minute plankton and the, you know, the beginning of the cycle of the marine biology to find that the contamination is really very high there.
Thank you.
Yeah. Yes.
I was gonna ask, you know, climate change is such a big thing, right? With so many wide range of health impacts across the world in varying fields, which you presented nicely today, thank you. As health scientists that are interested in, you know, starting research in this area, or maybe you're just getting into it, what's a strategy to, you know, best utilize our efforts to have an impact on it, especially given there's, you know, a long history of work that has already been done in this space, and there is so many dimensions that one can look at, like what can we do to do better, do good science, but as a strategy with our efforts?
Well, I think climate change is different from, for example, tobacco, where not everybody can fit themselves in tobacco. Everybody can fit themselves in climate. Tell me a discipline, and I'll tell you, you can do this or that. As public health, what has been happening is we are behind. Like engineers have been looking at energy, renewable aspects. Physical science, we're looking at atmospheric aspects. Ecologists, thank you. We're looking at the plants and all of it. Where were we? I mean, we were sleeping. Public health was behind. Now it's becoming front and central now. I was telling in the morning, like up to 2014, UCSD is a premier institution for climate change in Scripps, physical science. No one was even thinking about it in health sciences. So Ramanathan actually reached out to me. I was the only one who was kind of, working related to environment and say, this is a big problem. He convinced me, and I kind of switched almost 180 and said, whoa, this needs a lot of attention. So I was kind of fortunate to be able to bring this to the campus of health sciences. And now it's becoming much more popular, and we have actually a unit, climate change. So I think everyone can try and do something from their part, but there aren't enough people. And the funding, luckily, only now came through. Only now. I've been for 10 years, more than 10 years, saying climate, health, funding, NIH. No one was even considering it. And then guess what? Trump comes and climate has become a curse word. Like people were hiding it. I know somebody at CDC and saying, we used extreme weather, or, it was a taboo. It was just crazy. So Biden has came, I'm not Democratic or Republican, I'm just talking about the facts, and he put money into this. Like he's put a lot of money. Plus California is even better than the federal, and they have been so generous and supportive of this. But we need to tackle it as a multidisciplinary. Yeah. So that, like I showed you, our team, so economists, data scientists, implementation scientists, atmospheric scientists. This is the kind of approach we need. You can't go alone and say, I am going to do a difference, make a difference. No. Yeah, if you have a chance, the book is really, really freely available. Go through it, you'll get a lot of ideas, because each chapter is tackling the same problem of health, but from a perspective of, agriculture, water, policy, all of that.
I wrote down the title.
Yeah. Let's see.
Thank you so much, Wael. This is so awesome. What, knowing I'm from Lebanon, obviously, you know this about me. What are you finding are the biggest, maybe cultural challenges or other societal challenges with talking about climate change in the Middle East?
It's not on the radar. It's not on the radar because they have much more problems to deal with. Just a simple example, and that is something we talked about, but Lebanon had a couple of air pollution stations, and then they say we don't have any more money, so they brought it down, so they don't have any monitors. As simple as that. How much is the cost? $10,000 or something like that. So they were in a deep economical crisis. The last thing they're going to think about this. I think this is not going to go away, but as scientists and researchers and public health, we need to at least raise awareness. It doesn't have to be expensive to deal with the climate change impacts, like wasting food, trying to find renewable energy. Like I asked in Jordan, you are a poor country, you don't have energy. Why don't you have solar panels? You have the sun most of the year. Because people are controlling it, they're making it too expensive for people. Right? Because it's a business thing, and so the government can kick in and say, no, you make it subsidized or whatever, right? So these are the things. They sign up to the Paris Agreement, they sign up to this. But when it comes to implementation, the main problem, which, including here, they want results fast.
Yeah.
The minister is saying, I want results tomorrow, I need next month. I'm not gonna wait for something to show in. And that is the same problem here as well.
And would you say like at a people level, sort of at
Yes.
the individual and society, like when you talk to people who are not scientists or.
Yes.
Do you get the same sense of resistance, or is there more sort of willingness or interest in thinking?
No, I think there is complete ignorance, complete ignorance. Yeah, I mean, they are so far, like here, you have people who are deniers, but they know the topic, they're gonna argue and discuss it. There, I found it like it's kind of blank.
Yeah. It's also maybe close to some norms, where like in some areas, it's always been very hot, that maybe it doesn't.
Yeah, you know, it's kind of funny, you say that. I was invited to Kuwait to give a talk, and just before the COVID. And so then I on dinner, we were kind of with people, and one of them was a princess of the emir and so on. And she was saying, you know, you say heat and all of our lives we lived in heat. You know, let's look at the temperature. We go and sit in downtown and sip tea when temperature is 40 Celsius. I said, okay, what if you don't have electricity and there's an outage? What do? She was quiet, because they think that everything is independent. When you have electricity outage because of too much use of heat stress, you cannot survive with these temperatures. No, you cannot. Humans cannot. Plus, I asked an old man. I always like to ask the taxi driver. I said, what did you do before when it was hot? He said, you know, it was never like this hot. That's what he said. He said it was never hot like that. We would kind of have a shed, you know, put water and so on, because Kuwait is very well known. It's muggy and hot. But he was saying it wasn't like that. It was reasonable. Yeah. But the other thing, they were adapting to that temperature. This generation, no way.
Yeah.
From the car to the AC to the office to the home, no way. No way. Yeah.
Yes, please go ahead. Yeah, please.
So this is actually kind of relevant to Erica's newest paper that came out, but with, you know, the transition towards electric vehicles and the demand of natural resources to supply that transition, I'm just wondering, like, have you been reflecting or doing any work around some of the communities in lower income countries that are being affected by this natural resource extraction for some of those batteries, and just like the impact of that wide scale production on those communities?
I haven't, but I know some kind of, you know, like firsthand or experiences of what I saw of the plundering of resources. So I went to Mozambique, and we went out in the rural areas, and then the way going to that rural area and back, I saw these truckloads and truckloads and truckloads, one after the other, with these, you know, it's not related to the EV, but it's related to the climate change, with these big trunks of trees, you know, big trailers with, I think like each trunk is probably this wide, really big. They were all cut clean, very long logs, and I said, what is this? I've seen this. And then I saw this big storage, all of it from this. I was kind of, I hate it when people do this. Well, what's going on? He said, you know, this is corruption, ministry of, I don't know what, agriculture, whatever, made a deal with China. They come, they take these resources and ship it directly to China. From the forest to the port, the ships, and go there. And what are the people getting in return? Zero. Are they planting trees in front of it? No. How long did these trees take to grow that big? It's just devastating. So the same thing is happening in Afghanistan. So I have somebody who just went to visit Afghanistan. Afghanistan has a lot of these resources, a lot. And China is already there. You know, like on the surface, there's the Taliban and all of the politics and so on, but on the back end, they are going and plundering these resources for little pennies because they are poor, they're desperate, nobody's recognizing to just give them anything. I think the EV minerals are going to crash unless there is a resolution on how these can be reused or some other source. You know, driving electric vehicles can definitely help, but it's not the ultimate solution. Public transportation is the ultimate solution because, you know, we're gonna swamp all of California with electric vehicles. They haven't still sorted out what they're gonna do with the batteries when they're dead. You know, this is still a big question. So all of these are, I think we're always like this. We're going ahead and then figuring out what did we do, okay? You know, it's always like that. So you have a good point, and I've always raised this question saying, you know, the amount of energy needed to generate an electrical vehicle, you know, the electricity that is being used by charging this, is that really the solution? And the answer I get is, well, it's not the solution for everyone, whatever that means. But I think really investing in infrastructure is what is needed. And that is the ultimate solution. I'm glad to hear some of you today were saying, who is it? You told me Dominica said she doesn't have a car. I said, yes, good job. Yes.
In a classic academic way, it's more of a comment. but I would love to hear your reflection. You know, climate change is sort of like in both a lived experience as well as now professional work as well. And you know, in academia, often we're stating of this with a sense of discovery, right? So like, you know, like you very neatly summed up that the thing has been going on for a while. And you know, we shy away from questioning the real root causes, and a lot of literature is coming out that end of the day, when you strip it all down, it's neoliberalism, it's capitalism, it's American militarism, and it's imperialism. So I often think about, you know, people like yourself who are in this leadership capacity, what are the ways that we can integrate critiquing and questioning that part when you're thinking about including the GeoHub that you were sharing, right? So like, what are those strategies where we're not going to shy away from questioning that, right? Because like, particularly in the US context, I'm a migrant here, you know, academia, they like to think of themselves as liberal, but that's the American version of liberal, right? Like, you know, which is just, you create a facade that don't question Democrats because they're going to do
Yes.
So how do you sort of like balance that and really just go after the root causes? It's like a lot of the papers would spend paragraphs upon paragraphs to avoid saying capitalism or to avoid saying that Democrats are implicated in that process as much as we can. So yeah, just would love to hear some of your thoughts, reflections on that. I mean, including the Yemen example, for instance, you shared, right? So like a lot of that has to do with American imperialism and us selling weapons and so forth.
Yeah, I mean, so one of the things that it's similar but different. Again, tobacco and climate. So tobacco has one industry. Climate has many industries. These industries are the ones that keeps alive. Agriculture, transportation, gas, oil, energy, you name it. You can't scrap that. You can't just kind of say, go home. That is a process. I think the driving problem of the Anthropocene, which caused all of this, is stemming from capitalism and consumerism. I really think. But if you say that, what happens? You immediately block half or 60 or 70, 80% of the population you want them to change. They're not going to listen to you anymore. We have been trying to reach out to the Deep South with messaging. You know, the anti-democrat, pro-Trump and all of that. And, you know, how do you communicate to them when they say, oh, this is a liberal sport, toy and all of that stuff? What if you say the word capitalism? Ah, okay, cross, that's it. So it's a really tricky area. And I agree with you. I mean, Democrats have not been great, but the least thing they are recognizing, and now they're putting money. I mean, that's really a credit to them. And even Republican Congress, and in the book, this is written actually by Congressman Scott Peters, who wrote a chapter. He said, on the bar, and you know, my Republican friends tell me we believe in climate change, but our constituents would not elect us if we say that. So where's the change? You can't change it from top down. You have to change it from the grassroots. That's where the effort of health behavior and other aspects are needed to move the needle. But it's tough. It's that's why I said in the title, it's not preventable. It's not one industry and one source. It's very complicated.
So on that note, I would like to very much thank our speaker for an amazing talk. Thank you all for being here. Please come with us. We're going to the third floor, to room 301, to continue these discussions. And I know I could talk to you for 3 hours, and Ans, you can too, on these topics, and we'd love to pick your brains some more. But just to be respectful of people online and people who have to leave, our seminar time is over. Please join me in thanking Dr. Wael.
Again, I apologize for keeping you waiting. It increases the suspense.
Thank you so much for
Thank
doing
you.
this. Thank you.